Thank you for joining MSDC for its Washington Healthcare Wow series, where we dig into the issues that impact Washington, D.C.'s 10,000 physician licensees and the tens of thousands of patients whom they treat each and every day. This presentation is supported by Janssen, the pharmaceutical companies of Johnson & Johnson. Janssen is creating a future where disease is a thing of the past and collaborating for a healthier world. Today is World Multiple Sclerosis Day. There are nearly 1 million people in the United States who live with multiple sclerosis, or MS. And there are over 800 people here in the District of Columbia, according to the National Multiple Sclerosis Society. Today, we're going to look at the history of MS, the pathology of MS, the populations who get MS, as well as those who get it but may be underdiagnosed. And finally, we look at the patient perspective and provide patient resources for those living with MS. It's now my pleasure to introduce our presenters. First, we have MSDC member Dr. Robert Shin, who's a professor of neurology at MedStar Georgetown University Hospital. And we have Emily Reilly, Healthcare Provider Engagement Manager for the National Multiple Sclerosis Society. Dr. Shin and Emily?
All right. Hi, I'm Dr. Bob Shin. I'm a neurologist at Georgetown. I want to thank the Medical Society of DC for letting us present today. I'm going to start off, and then Emily Reilly is going to join us. We're going to try to give you an update about multiple sclerosis for World Multiple Sclerosis Day. Really, the story of MS goes back a couple of hundred years. So the first case of MS appeared in Northern Europe, again, a couple of centuries ago. The first description of MS was by Dr. Charcot. So he was in Paris, and this is a famous painting of him basically doing rounds. Behind him is his assistant, Joseph Babinski, from which we know Babinski's sign. You can see in the foreground, the gentleman in the apron is Georges Gilles de la Tourette, for which Tourette syndrome is named. But Charcot is sometimes referred to as the father of neurology because he was such a great observer. And in the late 19th century, he described a condition which we now know as multiple sclerosis. Interestingly, actually, it was one of his servants who had developed a tremor that progressively worsened. And Charcot noticed that unlike paralysis agitans, what we now know as Parkinson's disease, this person did not have a resting tremor, but had a tremor when she would try to do things. After she passed away, he was able to identify plaques within the brain and spinal cord, and he described this condition that we now know as multiple sclerosis. Now, the symptoms of MS really can be almost anything that the brain and spinal cord controls. So patients could describe or present with numbness and tingling. Maybe they have weakness, blurred vision in one eye or double vision. It could be cognitive symptoms or bowel and bladder symptoms, difficulty with balance. So the symptoms of multiple sclerosis are manifold. And so it really takes alertness to those symptoms for us to try to identify this condition in the first place. Now, where is multiple sclerosis? I mentioned that MS seems to have appeared on our planet a couple of hundred years ago in Northern Europe, but it has since spread, and we now see very high incidence of MS is still in Northern Europe, but also in the US and Canada, and then as you can see, also in Australia. This is a Mercator projection, right? So as you know, the countries are a little bit out of proportion in terms of their size, but we actually don't see a lot of multiple sclerosis near the equator or in South or East Asia, for example. But those numbers actually might be increasing. So this slide says that there are almost 3 million people living with MS worldwide. That's actually probably an underestimate. If we just focus on the United States, for instance, until recently, we thought that about 1 in 1,000 Americans have MS. Thanks to the National MS Society, actually, and some of the research they've supported, we now know that almost 1 million Americans have MS. So the incidence of MS is probably increasing, and we're getting better at recognizing it. But there is something interesting about where it presents. Again, Northern Europe, the US and Canada, maybe Australia, It's not clear why MS is sort of unevenly distributed. For example, some people would point out, well, Northern Europe, the US and Canada, Australia, these are all countries that are far from the equator. And there's been an observation that low vitamin D levels may be associated with an increased risk of MS. So maybe it's just, how much sunlight do you get? On the other hand, and again, partially thanks to funding from the National MS Society, there's been evidence that maybe Epstein-Barr virus might be a common trigger for multiple sclerosis earlier in life. And as we've seen, sometimes there are viruses that can spread around the world, but there could be different variants that might have different manifestations. And I would point out that maybe obviously the United States and Canada and Australia were populated by descendants of Northern Europeans. So you could even argue maybe for a genetic component. But honestly, there are some myths and misunderstandings about who might get MS. So for example, if we just focus in on the United States, it is a very diverse country, a country made up of immigrants. But for a long time, we've talked about multiple sclerosis as a condition that primarily affects people of Northern European ancestry, basically white individuals. And we've often focused on women being affected by MS more than men. So something that I was taught and that I've taught others is that multiple sclerosis is primarily a condition that affects white women. One thing that we've learned recently is that is not actually accurate. So for example, in the United States, multiple studies have now confirmed that the incidence of MS is the same in white Americans and Black Americans. It doesn't matter if you're African American or primarily white, the incidence of MS actually is the same. And so for a long time, we've probably been underdiagnosing MS in our African American population because of this bias. Furthermore, I need to emphasize that men get MS as well as women. It is true technically that women are diagnosed with MS more than men, but a large number of my patients with MS are men. And again, there's always this danger of underdiagnosing MS in a demographic that isn't part of the stereotype. So for me, when I think about who gets MS, it really could be anyone of any race and any gender. And I do think it's important for us to just keep that in mind and maybe stop focusing on just one particular demographic when it comes to multiple sclerosis. All right, now here's something else that's changed over time. I was taught about MS as having maybe different phases of MS. We focus on relapsing, remitting MS, and we would say that in the beginning of the disease course, there are episodes, attacks, relapses, exacerbations, and that in between the episodes, things were fairly stable. Maybe later on in the disease course, patients would stop having relapses, but gradually worsen. So if you had relapses first, and then you had gradual progression, we would refer to that as secondary progressive MS. Or we would say that there are some individuals where the first or only thing they've experienced is gradual worsening or progression, and we would refer to that as primary progressive MS. Well, this also is a little bit outdated. All right. What we now think is probably going on is that both components can exist at the same time. In other words, patients may have gradual worsening or neurodegeneration probably almost from the beginning of the disease course, and this might be punctuated by relapses. Now, because humans are kind of amazing creatures, we have a tremendous amount of neurologic reserve, which means early on that gradual progression, that gradual worsening might be hidden, if you will, below the surface, because our brain is able to compensate for that. And that might be the reason why it seemed as though progression was something that only developed later. Modern studies have told us when you do things like check for markers of neuronal injury, like serum neurofilament light, or you do special MRIs looking at the volume of the brain early on, or you use techniques like optical coherence tomography to measure the thickness of the retinal nerve fibrilla, you discover that there is neurodegeneration occurring almost from the beginning of the disease. It's just that it's masked by neurologic reserve. So I usually try to explain it using this sort of analogy from a TV show, basically. So if you had watched this TV show, Game of Thrones, it was all this sort of fantasy, medieval, people fighting and politics and intrigue. But I'm using this image from a battle where you can imagine like a line of soldiers forming a protective wall. And this is a lot like the blood-brain barrier. So our brain and spinal cord are actually sequestered behind a barrier from the rest of the body and from the immune system. However, in an MS attack, you'll see that there are immune cells that are going to penetrate that barrier. So this is sort of a depiction of a battle where these soldiers on horseback are crashing through that wall of soldiers. And this is really what we think is occurring when someone's having a relapse, an MS attack. As you know, there can be leakage at the blood-brain barrier. So on an MRI, for example, in MS, we'll see a focal inflammatory lesion with leakage of gadolinium where the blood-brain barrier has been breached and immune cells are flooding in through that barrier to attack the brain or spinal cord. And so this is what we would associate with an MS attack. Focal symptoms, we might treat these with anti-inflammatory medications. Usually patients will recover and then the barrier will be resealed and it might leave behind a scar, a spot on the MRI scan. And so this is sort of the feature of relapsing multiple sclerosis. However, there might be another kind of pathology. So this is a different scene in the series where these are the bad guys, but they've beaten the good guys and they're hanging out in their castle celebrating. So they've won a victory. Their castle gates are sealed. The doors are locked. They're safe within their castle walls. And I think of this as like sometimes in MS, you could have a situation where, the MRI looks stable. There may not be any breach of the blood-brain barrier, but there could be a hidden enemy. So in this series, while these people were celebrating within their castle, what they didn't know is that, I guess, an assassin had sort of snuck in amongst them in disguise and poisoned them. So even though they were safe within the castle walls, they were poisoned and killed. And this is what we think is happening in the progressive form of the disease, meaning even with an intact blood-brain barrier, there might be inflammatory cells within the walls on the other side of the blood-brain barrier, picking off neurons within the central nervous system. And this might be the basically mechanism behind that gradual progressive neurodegeneration. So I would say our modern thinking of MS is as both phenomena can occur. You can have neurodegeneration, you can have inflammation that is compartmentalized within the brain and spinal cord, causing gradual progression. This might be punctuated by the maybe more obvious breaches of the blood-brain barrier, which we call relapses. Now, how is this all relevant? Well, this mostly is significant because for the first time in history, in a way, we've had increasingly effective treatments for multiple sclerosis. Now, back in my medical training, actually, I was taught about multiple sclerosis as a condition that did not have any treatments. It was one of these neurological diseases. You would make the diagnosis, but there's really nothing you could do to help these individuals. We used to talk about people with MS being diagnosed, and there was a 50-50 chance that they would be in a wheelchair in 5 years. So the prognosis for MS was really devastating. In 1992, when Bill Clinton was elected president, there were no treatments. Now, by his second term, 1996, the early 1990s, we did have our breakthrough first treatments for multiple sclerosis, which were injected beta interferon. Modestly effective, still in use today in some regards, but things continued to progress. So when we got to the year 2000 and President Bush was elected, this sort of at the turn of the century, if you will, we had at least 3 different branded products. So some of you may remember a time when we talked about the A, B, C's of therapy based on their brand names. But things, again, continued to progress. And by Bush's second term, the president's kind of aging in their official photos. We had some additional treatments, but again, kind of centered mostly around self-injections. And again, these are modestly effective therapies. Now, when Barack Obama was elected president, we had our first monoclonal antibody for the treatment of multiple sclerosis. And then by his second term, we had our first oral therapies, our first pills for MS, which began to be approved in the 2010s. Things have continued to progress, actually. I'm not sure why President Trump looks so grouchy in his official picture, but you can see that we have increasing number of treatments for multiple sclerosis. And as of 2020, and now here we are in 2022, it's not even fitting on the page anymore. We have so many different treatment options for this disease. Now, in this talk, I'm not going to go necessarily into a lot of detail, but in my mind, actually, it's a remarkable expansion from Bill Clinton was not all that long ago. So from a condition that was untreatable to a condition where there, multiple, almost 20 different branded therapies, not even counting generic therapies for the treatment of multiple sclerosis. So for the purpose of this talk, what I wanted to highlight was, again, the recognition that multiple sclerosis is common in the United States in men, women of all races, that we've learned a lot about the pathology of MS. But one thing I also want to mention, what we've learned is that the earlier we identify MS and the earlier we use one of these highly effective therapies to control the disease, the better the prognosis is. And I just really wanted to emphasize that our role is to be alert to the possible symptoms of MS, to make sure that they're referred to Neurologic for neurological evaluation so we can make the diagnosis and get them on highly effective therapies as soon as possible. So that's the end of my session. I'm going to pass it over to my colleague, Emily Reilly. So take it away.
Thanks so much, Dr. Shin. Hello, everyone. My name is Emily Reilly, and I am a healthcare provider engagement manager for the National MS Society. What that means is I'm the liaison between anyone who treats patients living with MS in Virginia, West Virginia, Maryland, and DC. I've worked for them for about 3 years. I'm also a certified personal trainer, and I'm also a person living with MS. Dr. Shin talked a little bit about the history of how things have been, and I was diagnosed at the age of 17, almost 17 years ago. And back then there were only 4 drugs on the market. And so it's been amazing to see the progression over the last 16 years. I can say that MS has not stopped me, even though I was a pediatric patient. My neurologist told me not only to get on disease-modifying therapy quickly, but that staying active was really important. And so that's kind of what I use to go forward and not let this disease stop me. And so I now teach fitness classes for people living with MS, and I'm just really thankful to be able to say that 16 years later, MS has not stopped me, and I'm super thankful for that. One of the things that I do for the Society is provide information and resources for healthcare providers. And so for those of you who are watching this, I just want to kind of highlight some of the things that the Society has for you professionally. We have a wonderful professional resource center where we have tons of different information on symptoms, management, diagnosis. You've got opportunities to take a look at a lot of different professional education opportunities. We do a ton of different webinars on demand for you to be able to access a lot of these on specific topics, whether that's pregnancy and MS, different comorbidities, aging and MS. Dr. Shin has spoken on some of our calls as well. And so make sure you check those out. For those who are interested in having a career in MS, we do fund fellowships. So we're always trying to develop the workforce. If you want to be on our newsletter emailing list to get the MS Clinical Care Connection newsletter, make sure you reach out to me. I'll be happy to get you on that list so you can know up-to-date information on all things MS. And we've got a lot of really great resources for patients. So the National MS Society really wants to empower people affected by MS to solve their everyday challenges. And we do that through a lot of different ways. We have a wonderful program called the MS Navigators. It's the 1-800 number that people can call. They can also chat with somebody online. The MS Navigators are great. They provide goal-oriented support for people affected by MS. They help them navigate all the challenges, whether that's finding a neurologist, to getting connected to a self-help group, to maybe financial assistance or getting accommodations in their home. And so we try to provide that type of assistance and get them connected to those resources and support so they can continue living well with MS. We offer really great opportunities for newly diagnosed patients. Every month, we do a virtual program for those who are new to their diagnosis. They get to hear from a healthcare provider who's an MS specialist, along with a person living with MS, to share their own experience. They get connected to other people who are newly diagnosed to really empower them to move forward, knowing that MS doesn't have to stop them. We have some really great programs for the Black and Brown community, as well as the Hispanic community. So some really great opportunities for them to learn about how MS impacts their communities. We have tons of resources on wellness when it comes to exercise and nutrition, local support groups, and online MS communities. So lots of great resources that I'll be happy to get your patients connected to if that's something that they are interested in. Here's my contact information for you to be able to reach out to me so that I can get connected with you and get you all the resources that you need. And the National MS Society's contact information is here as well. We really appreciate you allowing us to come and share information and raise more awareness on MS in honor of World MS Day. If you have a few minutes, I always appreciate feedback on just the information we provide, as well as getting connected to you. So we hope you have a great day. Thank you so much for your time.